I couldn't let my father just sit there and suffer just because maybe a couple of people disagreed with the treatment that I was seeking out. Nobody said it was a cure, and I knew from the beginning I could come here and it does nothing, but it's the chance you have to take. You know, at that point in my father's deterioration, there was really no other choice. My name is Joe Leone, and I'm from Tampa, Florida, and I have brought my father to Qingdao, China to receive stem cell treatments. My father's name was Santoro Giovanni Leone. When he was in China, he was 56. Because he didn't make it to his 57th birthday, he was 56. He passed away in November, on November 18th, 2008. Which was about a month and a half after returning from China. And of course, after returning home from China, his condition was at the point where it was progressing almost exponentially every day. Originally, my father was diagnosed by the Mayo Clinic here in Scottsdale with a condition called spinocerebellar ataxia. However, upon visiting the hospital in China, we found out that it was actually multiple system atrophy. Well, I can tell you this, that I know it wasn't a genetic ataxia because I had him tested. I believe there's only 3 types of SCA that we can do a genetic test for, at least at the time. I had those tests done on my father. All the tests were negative. So, do I feel that the Mayo Clinic falsely diagnosed my father? No. I think that the doctor at the Mayo Clinic diagnosed the symptoms, not the condition. After going through everything that I went through, do I feel that MSA was the correct diagnosis? Absolutely. And the reason is because historically looking at it and thinking back and looking at the conditions and the symptoms, his symptoms more closely matched MSA. When he originally started getting sick, he was about 52 years old, and it started out with a stumble every now and then around the house. As the condition progressed, it got a little bit worse. It started affecting his balance. He started off, just being a little unstable walking around. Then it went to, using like a cane, and went to using a walker, and then it went to the wheelchair. Probably the worst thing that I think that I seen him suffer with, it wasn't the not being able to walk around. Everybody seems to think that it would be detrimental to be confined to a wheelchair. I'm here to tell you that I've tried the wheelchair just as well as my dad, because I wanted to show my dad that I can do this too, to give him a reason to learn how to work the wheelchair better. Because I figured that if I give him more incentives or give him maybe he could one-up me on something, that would give him a reason to do it. But his quality of life, the one thing that I wish that I could have taken away from him was the constant dizziness. The dizziness was probably the worst thing. Probably within about 6 months of me knowing that he had a condition, he was hospitalized and lost his job. Once he lost his job, personally, I knew that he needed to be taken care of. So I quit my job and stayed home with him every day and took care of him every day while I researched the balance disorder. Trying to find out what was wrong, seeing if there's another doctor, in another city, another town, another country, another state, wherever. It didn't matter at that point. Upon finding out about the hospitals in China, specifically the Beike biotech company, I began to do some other research and maybe find if there were other places maybe a little bit closer to home. And some of those places included, obviously Mexico, Costa Rica. There were some places in Eastern Europe, the Ukraine. There were also some places in the Caribbean. Some of these places wanted in the neighborhood of $50,000 US money per injection, which after receiving the diagnosis from the Mayo Clinic and then sitting down and comparing the stem cell therapy plus the other additional benefits that you got from the hospitals in China, the physical therapy, the speech therapy, acupuncture, traditional, Chinese cupping therapy, it seemed to be that everything was included with the Beike deal, let's call it. Whereas the rest of these places were just simply offering individual stem cell injections. And in some of these other places, what was really concerning me was they couldn't verify to me where these stem cells were coming from. That's how I really came to decide about using the hospitals in China versus anywhere else was because of that. The verification that I knew where the stem cells were coming from. I knew they were from healthy full-term babies. I knew they were pre-screened for diseases and genetic disorders. So I mean, there was a lot of advantages that Baker Biotech offered versus the competitors. If I remember correct, left the United States from the Tampa airport September 6th, 2008, arrived in Qingdao about 31 hours later, and I was there for 45 days with my father. Long enough to receive 8 stem cell injections. A lot of the physical therapy that they did revolved around balance training, training him to, it was like motor mechanics, you know, one foot in front of the other. And it was almost like he had to learn how to walk again. And then there were different days where they would maybe do some like stretching on him. Now, in addition to the physical therapy, he also received acupuncture therapy, where they did a lot of acupuncture relaxation, where they were hitting on points that were specifically designed to enhance relaxation. They also did some acupuncture on the bottom of his tongue to possibly help his speech as a speech therapy, which, by the way, that did work, and it worked for about 48 hours. It really hurt him, but it did work, and it worked very, very well. I'm going to be 100% honest with this. The very first injection, I didn't see any improvement. But a lot of stem cell therapy patients need to understand that you're not going to see immediate improvement off of this. And that was what I was under. But understand, nobody had told me you're going to see immediate improvement. I made that inference on my own, because always before, you know, you need pain medication, they give you a shot of Demerol, and in a few seconds, you're not in pain anymore. So I guess maybe that was my thought and his thought. After the first injection, really didn't see anything. The second injection was minor stuff. And the stuff that I was seeing was stuff that would show up in his physical therapy. Like his feet weren't shuffling. Other things like after the third injection, he was able to walk a little bit better. And up until about the fifth injection, I saw minor but significant improvements. The sixth, the seventh, and the eighth one, I'm not really sure that I saw improvement, but I think the reason why I didn't see a lot of that improvement was because at that time his psychiatric condition had worsened pretty significantly. But did I see improvement? Yeah. You know, I've often wondered, you know, what if I could have afforded 100 stem cell injections? You know, what if I was still there in the hospital and every week he still gets a stem cell therapy injection? I really believe that if I was still in China with my dad at the hospital, then Dad would still be alive today. This is not based on research. This is not based on anything that I've read. But it seems that at least common sense inferences here, with these degenerative conditions, you need to go back multiple times. Maybe one day these stem cell therapy injections will be more affordable, so that, you know, in 10 years from now, when someone else's dad gets the same condition, that maybe we can just treat them here. Here again, I've seen kids that came there blind that left seeing, so I know it does something. You know, I'm also often wondered in times that maybe I just got to my dad's condition too late, and maybe that's the reason why I didn't see some of the improvement that I wanted. Now, I will tell you that I think one day my dad actually woke up after a stem cell therapy injection and told me that the dizziness was gone. Now, the dizziness would kind of come and go in the early stages of his condition, but this was unique because this was in the late stages of the disease. And even though it was only like 6 hours, he wasn't dizzy. And he actually smiled. Did something that he hadn't done in a year or two. So, does that give you a little bit of quality of life? Well, yeah, it does. Because at least for that 6 hours, you may have some physical deterioration, but at least you're not dizzy,